When to reopen Connecticut, it's a decision left to Governor Ned Lamont, and he says deciding when to reopen the state is a business decision, but more importantly, a public health decision.
My administration is issuing new federal guidelines that will allow governors to take a phased and deliberate approach to reopening their individual states.
I just came from a teleconference with the president and vice president, and they'll be announcing very soon their plan. They call it Opening Up America. And it's interesting, there they give guidance. They leave it up to local governors.
Governor Ned Lamont introducing business executive and former Pepsi CEO Indra Nooyi and Yale Health epidemiologist chairman Dr. Albert Koh. Both will lead Lamont's reopening task force set to create a plan on when and how businesses can reopen while keeping Connecticut safe.
Our goal on this task force on this advisory group, is to develop a plan to reopen Connecticut as soon and as safely as possible, using fact-based analysis, very carefully considering the public health consequences of anything we do, and we want to make sure whatever we come up with is a sustainable approach.
On the medical side, Dr. Koh says they'll base the decision off certain metrics, including a decline in cases and hospitalizations, an uptick in mass testing, tracing, and self-isolation, the protection of high-risk populations such as seniors and those with underlying health conditions, an adequate supply of PPE, social distancing, and healthcare capacity for all. On the business side, Nooyi says the task force will begin looking at different strategies involving small businesses and the workforce.
Can we open it regionally? Can we go by industry segment? Certain segments like beauty salons, nail salons, hairdressers. Should we go by industry segment? Should we do large companies versus small companies? Should we do it by age and risk groups? And the most important goal, avoiding a COVID-19 rebound.
Real threat that we're worried about is what the governor had referred as rebound outbreaks that may occur. We've seen these rebound outbreaks occur in other countries, and even if we reach the benchmarks to reopen, this disease is not going to go away.
And state officials say they will begin establishing that timeline over the next week for when Connecticut starts the reopening process. In Hartford, Nia Maldonado, Fox 61 News.